Imagine this, you're a single mother working 2 jobs and suddenly your child falls terribly ill. You rush to the emergency room, your heart pounding with worry, only to be met with another fear, the daunting reality of being uninsured in America. This is a scenario that plays out far too often, forcing millions to grapple with the harsh realities of a healthcare system that can feel inaccessible and unforgiving. For many uninsured Americans, seeking medical care becomes a gamble. The fear of exorbitant medical bills becomes an unwelcome companion to their health concerns. This can lead to agonizing decisions, delaying essential care, forgoing necessary medications, or even avoiding seeking help altogether. The consequences can be dire, turning manageable health issues into life-altering crises. The stories are heartbreaking. A young father with a broken leg, forced to choose between paying rent or getting the surgery he desperately needs. A diabetic grandmother rationing her insulin, unsure if she can afford next month's supply. These are not mere anecdotes. They are the harsh realities for countless Americans navigating a complex and often unforgiving healthcare system. The lack of insurance creates a chasm between needing care and accessing it, leaving many stranded on the wrong side of a system designed to protect them. Despite the financial anxieties, one critical legal protection exists for all Americans, regardless of their insurance status: the Emergency Medical Treatment and Labor Act, or EMTALA. Enacted in 1986, EMTALA ensures that anyone needing emergency medical care receives it, regardless of their ability to pay. This means that a hospital emergency room cannot turn away a patient in a critical condition, even if they are uninsured. This law is a crucial safety net, guaranteeing that a heart attack, a car accident, or a child's sudden illness will not be met with a closed door. It ensures that the most vulnerable in our society, the uninsured, the poor, the undocumented, are not left to die because they lack financial resources. However, while EMTALA addresses the immediate need for emergency care, it does not cover ongoing treatment or follow-up care. This is where the limitations of EMTALA become apparent. While it mandates immediate care, it does not address the long-term needs of patients. For instance, an uninsured patient stabilized after a heart attack may be released without crucial follow-up appointments or medications. This gap in coverage can lead to a revolving door effect, where patients cycle in and out of the emergency room, their conditions worsening without access to consistent preventative care. Once the immediate crisis subsides, the harsh reality of medical bills sets in. For the uninsured, navigating the labyrinthine world of medical billing can be overwhelming. Bills arrive often filled with confusing medical jargon and staggering figures. The fear of crippling debt becomes a constant source of stress, adding insult to injury. Hospitals and other healthcare providers are obligated to offer payment plans, but for those struggling to make ends meet, even these can be out of reach. The weight of medical debt can be crushing, leading to difficult choices. Families may be forced to deplete savings, sell assets, or even face bankruptcy. The psychological toll can be just as damaging. The stress of medical debt can lead to anxiety, depression, and strained relationships. Many find themselves trapped in a vicious cycle, their health further compromised by the financial burden of seeking care. The lack of insurance creates a double-edged sword, where the very act of seeking help can plunge individuals deeper into financial insecurity. Section 4. Who foots the bill? Unveiling the hidden costs. When uninsured individuals cannot afford their medical bills, the costs don't simply vanish. They are absorbed by the healthcare system, ultimately impacting everyone. Hospitals often write off unpaid bills as uncompensated care, shifting the burden to those who can pay, the insured. This translates into higher premiums and increased healthcare costs for everyone. Beyond the financial implications, the lack of insurance has broader societal consequences. Uninsured individuals are more likely to delay or forgo care, leading to poorer health outcomes and increased mortality rates. This can result in lost productivity, increased disability, and greater strain on social safety net programs. Moreover, the uninsured often rely on emergency rooms for non-emergency care, further straining an already overburdened system. This overuse of emergency services drives up costs and can delay care for those experiencing true emergencies. The consequences of being uninsured ripple outwards, impacting not just individuals but the entire healthcare ecosystem. Section 5. A society-impacted consequences and potential solutions. The plight of the uninsured is not just a personal tragedy, it is a societal crisis that demands attention. The lack of affordable, accessible healthcare undermines the very fabric of our nation, leaving millions vulnerable and creating a system that is both inefficient and unjust. Addressing this issue requires a multi-pronged approach, focusing on both immediate relief and long-term solutions. Expanding access to affordable insurance options remains a critical step. Strengthening the Affordable Care Act, streamlining enrollment processes, and offering subsidies to make coverage more attainable are crucial. Investing in community health centers, which provide care to underserved populations regardless of insurance status, is another vital strategy. Finally, addressing the underlying costs of healthcare is paramount. This includes tackling the high price of prescription drugs, promoting preventative care, and streamlining administrative processes. Creating a more efficient and cost-effective healthcare system benefits everyone, regardless of insurance status. It's time to recognize that the health of the uninsured is inextricably linked to the health of our nation.